Welcome to today's video on pelvic floor disorders, a condition that affects millions of people, especially women. But what exactly is the pelvic floor? The pelvic floor is a group of muscles and tissues that form a supportive hammock at the base of your pelvis. It holds up key organs like the uterus, bladder, and bowel, ensuring they function properly. However, this vital muscle group can become weak or damaged over time. So what causes pelvic floor disorders? The main culprits include pregnancy and childbirth, which place tremendous stress on the pelvic area. Aging, surgery, radiation treatments, and even being overweight can also contribute to pelvic floor issues. When the pelvic floor muscles weaken, they can no longer support the organs as they should, leading to a range of uncomfortable symptoms. Let's talk about some of the most common symptoms. Many women describe a feeling of heaviness, fullness, or a pulling sensation in the vagina, especially later in the day or during bowel movements. Others may notice a bulge or feel like something is coming out of the vagina. These sensations are often early signs of a pelvic floor disorder that shouldn't be ignored. Beyond discomfort, pelvic floor disorders can also cause urinary problems. Difficulty starting to urinate, incomplete bladder emptying, and frequent urinary tract infections are common complaints. In more severe cases, women may experience urinary incontinence, where they leak urine during everyday actions like coughing, laughing, or exercising. In addition to urinary issues, pelvic floor disorders can also affect bowel movements. Some women struggle with controlling gas or leaking stool. Others experience chronic constipation or find it difficult to make it to the bathroom in time. These symptoms can significantly impact daily life and emotional well-being. If you're experiencing any of these symptoms, it's important to talk to your healthcare provider. Diagnosing a pelvic floor disorder often begins with a physical or pelvic exam. In some cases, special tests may be required to assess the severity of the condition and guide treatment options. Fortunately, there are effective treatments available. One of the most common is performing pelvic muscle exercises, also known as Kegel exercises. These exercises help strengthen the pelvic floor muscles, improving support for the bladder, uterus, and bowel, which can alleviate many symptoms over time. Another non-surgical treatment option is a pessary. This is a mechanical support device inserted into the vagina to help lift and support the pelvic organs. It's a simple, effective solution for some women, especially those who aren't ready for surgery or who want to explore less invasive options first. In more severe cases, surgery may be required to correct the pelvic floor disorder. Surgical options vary depending on the specific condition and its severity. Your healthcare provider will work with you to determine the best course of action, which could involve repairing or reinforcing the pelvic floor muscles. Medications may also play a role in managing pelvic floor disorders. Some medications are designed to treat overactive bladder symptoms, while others target constipation or other bowel-related issues. Combining medications with other treatments can lead to significant symptom relief for many women. Living with a pelvic floor disorder can be challenging, but it's important to remember that help is available. From exercises and devices to surgery and medications, there are numerous ways to manage the condition and improve your quality of life. The first step is recognizing the symptoms and seeking the appropriate medical advice. If you or someone you know is experiencing pelvic floor issues, don't hesitate to reach out to a healthcare provider. Early intervention can make all the difference. Stay healthy and take care of your pelvic floor.